I want us to look at a coding clinic. This is a publication published quarterly, as it says here, by the American Hospital Association, AHA, and it is for coders who are doing both diagnosis coding, ICD-10-CM, and procedure coding, ICD-10-PCS. This particular one is the fourth quarter 2016. You'll notice as you scroll through, and I've got it expanded to 163%, so it would be quite a bit smaller if you were reading it. But you see that there's going to be changes to your diagnoses reporting, CM, changes to your procedure reporting, PCS, and a special section on heart assist devices. It starts off with new and revised diagnosis codes and goes through them alphabetically. Then you scroll down and you find new and revised PCS procedure codes, and they also are listed alphabetically. We will focus on the diagnosis codes since that's what we're having in this class. The last section is Ask the Editor, where it's very specific questions come in from veteran coders asking these AHA body what the right response should be to a particular scenario. You see here the Zika virus is included in the diagnoses because that is something relatively new to the coding world. So I'm going to scroll down to page 4. We're on page 2 right now. Scrolling down to page 4. I wanted to show you too, you notice here the executive editor of the coding clinic is Nellie Leon Cheeson. That's also the author of your textbook. She does an excellent job of covering everything. I just wish that the chapters in her textbook matched the chapters in the code book, but they don't. Okay, keep going down to page 4, the Zika virus. The coding clinic tells us that the code A92.5, Zika virus disease, has been created to uniquely identify Zika and Zika not otherwise specified. And then it goes into a little bit of explanation or description of what the Zika virus is, incubation periods, that kind of thing. Talks about how the World Health Organization felt it was very important to document during pregnancy because it could cause microcephaly, which is the pictures we've seen on the news of the babies with the heads much smaller than normal, as well as many other physical problems for these little babies. It reminds us that in all cases, inpatient and outpatient, we're going to code only confirmed diagnosis based on the provider's diagnostic statement. The doctor's diagnostic statement that the patient has been infected by Zika is sufficient. That's an exception to other guidelines that felt that in general, in an inpatient setting, uncertain diagnoses would be coded as if it was established. But that's not true with Zika. If the doctor says probable Zika infection, you do not code it. You would only code it if the doctor says the patient has Zika virus infection. Then there's a few bullet points to remind us of that very same thing. So you see how it takes a topic, goes into some detail explaining about it, and this is a way of educating coders. It also is a standardization so that all coders are coding the same way. If we were coding differently, there's no way we could compare our data. I also wanted to show you how it addresses specific diagnoses that are new, like hypercholesterolemia. It's on page 13. So I'm going to scroll down to 13. We're on page 6. Scroll down to 13. And this is an explanation of hypercholesterolemia, where the coding clinic is reminding us or teaching us that E78.0, pure hypocholesterolemia, has been expanded to create code E78.00 for pure hypercholesterolemia, unspecified, and code E78.01, familial hypercholesterolemia, in order to improve detection and screening in patients with this treatable condition. Then it goes into some explanation of what a familial hypercholesterolemia would be, how it would be described. The last thing I want to look at is one of the letters to the editor on page 142. This is one of the questions for the editor. The question is, we have previously been extensively trained that the diabetic cataract is rare and may occur with rapid onset in type 1 diabetes. Coding clinic for ICD-9-CM, which obviously that was several years ago when ICD-9 was the code set, not ICD-10. ICD-9 previously informed us that the type of cataract more commonly found in adult diabetic patients is the age-related cataract, which is not classified as an ocular manifestation of diabetes. The new with, in quotation mark, guidelines instruct us to link any condition indented under the word with to diabetes. In this guideline, all cataracts in diabetic patients are diabetic. Is there a change in understanding of the pathophysiology of the diabetic cataract, and if so, are all cataracts in diabetic patients now considered diabetic cataracts? This is a very good question. For a coder that's been coding for a long time, she's now getting mixed messages from the different coding clinics. So the editor's answer is, the advice published in the coding clinic dates back to 1985. Based on the revised guidelines and changes in the understanding of the relationship between diabetes and cataracts, cataracts in diabetic patients should be coded as linked conditions. Cataracts are considered a major cause of visual impairment in diabetic patients, as the incidence and progression of cataract is elevated in patients with diabetes mellitus. Several clinical studies have shown that cataracts develop more frequently at an earlier age compared to non-diabetic patients. So that is the answer. So you see how the coding clinic provides guidance to all coders for how we would code specific scenarios. This is often a question on the national exam that asks what publication provides guidance to coders. And there'll be a multiple choice question, and the answer you're going to be looking at is the coding clinic. If you have any questions about coding clinic, please post them in discussion board. I encourage you to read through these. I know they're not going to make as much sense to you now as they will at the end of the semester, but hopefully you can remember to look back at them. Since ICD-10, our coding clinics have been quite lengthy because there's so much more to look at than there was with ICD-9-CM. Thanks so much and have a good afternoon.